Guys, welcome back to my YouTube channel. Today we will be discussing PRP. Now before we start a discussion on PRP, we need to understand one basic thing. There is one vial called EDTA vial and there is another vial called ACDA tube. Now EDTA tube and ACDA tube both have anticoagulants in them. Both can be used to separate PRP, but EDTA has the anticoagulant in EDTA damages the platelet more, and plus it is not of the same pH as that of blood, so the injection is more painful. ACDA has more citric acid, it is more closer to the body's natural skins and the blood's natural pH, and hence the injection is less painful. So PRP is separated preferably in ACDA tube. After that, just a second. Yeah. So to segregate PRP, we will use wide bore tube, 21 gauge needle. Now why do we use wide bore tube? We could have used a small tube also. We could have taken a small needle also to take out PRP, but then that will damage the platelets. So we use a wide bore needle, 21 gauge needle, plastic tubes, dropper, tourniquet, sterile gloves. Now we clean the antecubital area and 36 ml of blood is taken in 4 tubes of ACDA. We have already discussed that we don't take EDTA because it is painful injection. We take ACDA and ACDA. Now after taking ACDA, we mix the anticoagulant. So we have taken it in a vial, but we invert the tube 8 to 10 times and mix the anticoagulant properly, and it separates. It helps. And then we go for the first spin. The first spin helps to separate RBC from platelet. Now 5 to 6 ml of plasma is usually injected when we give PRP, but this comes later, but it is ideally injected, and this we will discuss later. Just a second. Now first spin, it depends. Now how you give the spin depends on, now how the spin is given depends on the device that you're using. There is a formula that is used to calculate the spin frequency and the spin duration. See, just a second. Relative centrifugal force is 1.18 times into 10 to the power 5 into radius of the rotor. So PRP machine, it depends on radius of the rotor squared the speed of centrifugation in revolutions per minute. So centrifugal force is already pre-decided, but radius of the tube times speed of the centrifugation will decide the relatives. So the radius basically will decide the speed of revolution or the number of revolutions that we give. So basically you have this kind of an instrument. So basically inside of a PRP tube is like this. No. Now the diameter or the radius of the tube will decide the number of spins and the frequency and all of that we give to the patient. So for most of the devices we give around 3000 spins for 5 minutes for the first rotation. The supernatant of the first spin is transferred into sterile bottles. Now what is there in the supernatant of the first spin? RBC settles at the bottom. You have buffy coat, you have platelet poor plasma. All of the upper part portion is transferred into another tube. RBC is separated out, and then you rotate it again. Now for the device that I am discussing, 7000 rotations were given for 17 minutes after that. Now after the second spin, you have platelet poor plasma on the top, you have platelet rich plasma and leukocyte rich plasma at the bottom. So leukocyte rich plasma can be discarded, and platelet rich plasma or platelet poor plasma can also be discarded. You can take platelet rich plasma and you can infuse it. Now how do you infuse it? You give 5 to 6 ml plasma, ideally at 1 centimeter square gap, and 0.01 ml of plasma is given at one place. So this is all about PRP. I hope this lecture was useful. If you want me to make more such lectures, comment below.